So everything I planned, by the way, failed because I think God had a better plan. So I thought we're going to go after businesses, and yet our first 1,500 patients were all private.
Just individuals.
Just individuals.
Yeah.
Individuals who didn't have insurance. We think there's some misnomers in the world. The world's overpopulated. Well, not really. Everybody in the world can fit into like New Jersey here,
right, right.
with a square, with a football field size, property or something like that. One of the misnomers is everybody has insurance, and they don't. And if they do have insurance, I don't know what the percentage is, but if they do have insurance, they have this deductible of $5,000
at minimum now.
Minimum.
I mean, $5,000 is nothing anymore.
And they have copays.
Yeah.
And so really they don't have the access that everybody thinks they do, because you see a mole on your skin and you go, boy, I wonder if that's cancer, but gee, is it worth $40 copay and then a $180 office visit?
Yeah.
And so they don't get those things looked at. Well, what happened is I went from having 3,500 patients to about 100. And it just slowly built and built and built and built. And I changed patients because, again, my practice was based on insurance, Medicare, Medicaid. And now my practice was based on individuals that didn't have any of that.
Yeah.
And there's a lot of those out there. In fact, I think the majority of the population does not have insurance.
Well, it depends on how you define insurance. Like Janet and I we're uninsured. We don't have insurance because we have a health sharing ministry. I imagine a lot of your patients have a health sharing ministry also. But also, people are underinsured when you say the high deductibles. Yeah. There are many employer-based insurances now. Their deductibles for their employees, their deductibles are like $7,000.
Right.
So, like you say, most employees don't really access it anyway because they're paying out of pocket for most everything anyway. And then that's when it starts getting expensive.